Very good afternoon to all of those who are joining me live on the Facebook page of News9. I'm Neha. The experts have attributed the rising number of cases in the national capital to the careless attitude of people. Now, wearing masks, social distancing, among other precautionary measures are not being followed by the people, which led to the surge in COVID-19 cases in Delhi. This is what the experts have stated. They've also warned people against letting their guard down. Dr. Upali Nanda of a particular hospital in the national capital, while talking to a news website, stated that people are not wearing masks properly, and even if they are doing it, it's not the proper way, which is all the people are supposed to cover their nose and not their chin and mouth. Dr. B.R. Sherwal, the medical director of Rajiv Gandhi Super Speciality Hospital, also stated that people letting their guard down is indeed worrisome. The active cases in Delhi, do remember, are at 32,097. While this is the expert opinion, the Delhi Health Minister is of the view that numbers are rising because of the increase in testing. Now, what exactly is the reason behind the exponential rise again? Let's take an expert opinion on it as Dr. Satish Roy joins me over the phone line. In fact, he joins me live with more inputs on it. Thank you very much, Dr. Satish, for taking out some time and speaking to us. Do tell us, sir, COVID surge in Delhi is being attributed to the careless attitude of people. Now, after successfully curbing the spread initially, or at a later stage rather, the national capital is again witnessing a surge. Any particular reason for it apart from people not adhering to COVID-19 norms as they should?
So Neha, there are several reasons why cases would rise at this stage. The biggest reason we have to remember is that the virus does not spread itself. People spread the virus. So if people are going to go through the phases of Unlock 4.0 and start moving around, go to work, use some public transportation, interact with each other, marketplaces opening, restaurants potentially opening. As interaction increases in closed spaces, it is expected that the cases will rise if people are not taking adequate precautions. So as you rightly mentioned, a lot of people have let their guards down. And as a consequence, we will see that the virus will be able to spread because, as we know, 10% of people spread 90% of the cases because there is a phenomenon called super spreaders. And many a times these super spreaders might have very mild infection. They may not have a very severe infection to know better. And hence it becomes even more important for people to continue to protect themselves and their families and take all the possible precautions if we have to curb the spread. The virus is going to find new targets because as more and more people interact who had been staying at home and who were not coming out and start going back to work, etc., we can expect the virus to spread further.
Right. Dr. Satish, India also has been reporting an exponential rise in the number of cases. The onus, as we understand, is on the people. But since it's not happening largely, as you also mentioned, is it time for the respective state governments to bring more restrictions in place to avoid further spread?
I have two opinions on this, Neha. One, I find that, even as a practicing physician, when we give instructions to patients, we may do our very best to tell them what to do. And we may even penalize them, but it does not seem to get through. We really have to appeal to the human being at his personal level of why this is important and appeal in such a way that they feel that they are empowered to follow what they are being told. And I truly believe that in this, the biggest factor that works is public media messaging. So through programs such as yours and also through the news, because in India people tend to follow their role models, and the role models of people in India, for example, are their Bollywood stars or they are film stars or they are cricket stars. And if all of these people came together and kept giving them the message that do not let your guard down, the virus is still around, wear your mask, show them videos on how to wear the mask correctly, and get the message across through appealing to their emotional and personal side that they are protecting their family, their friends, and their society, I truly feel it will work, because penalizing has a limitation to how much you can put restrictions on people, because this is a very large country of 130 crores. And I think that our police forces and other systems would be overwhelmed trying to get every person to wear their mask correctly. So I think it's all about public education, public messaging, messages from the highest authorities in the country, and a consistent messaging. We as doctors are doing our best, but I feel that we need help, literally.
Right. So, I completely understand, and you made a very good point here, doctor. So, the number of rapid antigen tests, if we have to speak about, conducted on a daily basis is way more than the number of RT-PCR tests conducted. But we know that rapid antigens can be false. Is this also the reason for the rising number of cases?
It certainly can't be discounted that the rapid antigen tests, because they do have a false positivity rate and a false negativity rate, which is called the sensitivity and specificity of the test. But even if we take that into consideration, it would not overestimate the cases by more than 10 or 15%. And that's about the percentage, if we take the number of cases being missed by a rapid antigen test, that is actually higher than that is missed by an RT-PCR. So if anything, we might be underdiagnosing, not overdiagnosing. It is true that we are doing a lot more tests and we are picking up more of the mild or asymptomatic cases, and hence the numbers are rising. And I do believe that within this, the patients that have moderate to severe disease should be taken in for the right care, because I feel that is where it is just not the testing, but the care and the treatment after the testing that is so important and needs to be followed through, including the isolation of these people. Because if these people after being tested are not isolated and they roam around, they're going to spread the infection to others.
Right. So, doctor, lastly, what should other states learn from Delhi in terms of, rising numbers even after handling the crisis pretty well, if I may say so?
I think that the message uniformly, not just from Delhi, but from across the globe is the same. And that is, don't unlock too fast. Don't let your guards down too fast. Continue to wear your mask. It is said that if 90% of the population, mark my words, Neha, if 90% of the population wears the mask correctly, we can actually break the chain of transmission very, very successfully. There is now statistical, mathematical data that has very well shown this, and countries like Taiwan, countries like South Korea, Japan, have proven this to us, that wearing the mask is the most important thing, and every state, every city, every village where it is spreading needs to recognize this and cover your nose and mouth. There's only one message through all of this, and physically distance, travel only when required, and make sure that you're doing your hand washing sincerely. That's all I would say.
Right. Dr. Satish, thank you so very much. Wonderfully explained. Of course, for joining me on the Facebook page of News9. Now you all know what exactly you are not supposed to do. Please wear your mask and wear it correctly. Cover your nose and not your chin and mouth. And please make sure that you're taking all the preventive measures that have been put in place to avoid the further spread of COVID-19. Of course, the numbers have been rising at a very fast pace, but whatever is in our hands, let's make sure we do that. Thank you so very much for joining me. Please take care of yourself as well as your family members. If at all you like this video, don't forget to subscribe News9. Thank you so much.